17 effective ways to lower your blood pressure. High blood pressure, or hypertension, is called the silent killer. It often has no symptoms, but is a major risk for heart disease and stroke, and these diseases are among the leading causes of death in the United States. Your blood pressure is measured in millimeters of mercury, which is abbreviated as mmHg. There are two numbers involved in the measurement: the systolic blood pressure and the diastolic blood pressure. The systolic blood pressure is the top number, represents the pressure in your blood vessels when your heart beats. The diastolic blood pressure is the bottom number, represents the pressure in your blood vessels between beats, when your heart is resting. Your blood pressure depends on how much blood your heart is pumping, and how much resistance there is to blood flow in your arteries. The narrower your arteries, the higher your blood pressure. In this video, we will tackle the 17 effective ways to lower your blood pressure levels. Before we proceed to this video, don't forget to click the thumbs up button, share to your friends, and subscribe to Earlyseven YouTube channel for more rad-clusive videos. 1. Increase activity and exercise more. In a 2013 study, sedentary older adults who participated in aerobic exercise training lowered their blood pressure by an average of 3.9% systolic and 4.5% diastolic. These results are as good as some blood pressure medications. As you regularly increase your heart and breathing rates, over time your heart gets stronger and pumps with less effort. This puts less pressure on your arteries and lowers your blood pressure. A 2014 review on exercise and lowering blood pressure found that there are many combinations of exercise that can lower blood pressure. Aerobic exercise, resistance training, high-intensity interval training, short bouts of exercise throughout the day, or walking 10,000 steps a day may all lower blood pressure. 2. Lose weight if you're overweight. If you're overweight, losing even 5 to 10 pounds can reduce your blood pressure. Plus, you'll lower your risk for other medical problems. A 2016 review of several studies reported that weight loss reduced blood pressure by an average of 3.2 mm Hg diastolic and 4.5 mm Hg systolic. 3. Cut back on sugar and refined carbohydrate. Many scientific studies show that restricting sugar and refined carbohydrates can help you lose weight and lower your blood pressure. A 2010 study compared a low-carb diet to a low-fat diet. The low-fat diet included a diet drug. Both diets produced weight loss, but the low-carb diet was much more effective in lowering blood pressure. A 2012 analysis of low-carb diets and heart disease risk found that these diets lowered blood pressure by an average of 3.1 mm Hg diastolic and 4.81 mm Hg systolic. Another side effect of a low-carb, low-sugar diet is that you feel fuller longer, because you're consuming more protein and fat. 4. Eat more potassium and less sodium. Increasing your potassium intake and cutting back on salt can also lower your blood pressure. Potassium is a double winner. It lessens the effects of salt in your system and also eases tension in your blood vessels. However, diets rich in potassium may be harmful to individuals with kidney disease, so talk to your doctor before increasing your potassium intake. Bananas, apricots, avocados, oranges, milk, yogurt are some of the foods that are rich in potassium. 5. Eat less processed food. Most of the extra salt in your diet comes from processed foods and foods from restaurants, not your salt shaker at home. Popular high-salt items include deli meats, canned soup, pizza, chips, and other processed snacks. Cutting out processed food will help you eat less salt, less sugar, and fewer refined carbohydrates. All of this can result in lower blood pressure. According to the U.S. Food and Drug Administration, a sodium listing of 5% or less on a food label is considered low, while 20% or more is considered high. 6. Stop smoking. Stopping smoking is good for your all-around health. Smoking causes an immediate but temporary increase in your blood pressure and an increase in your heart rate. In the long term, the chemicals in tobacco can increase your blood pressure by damaging your blood vessel walls, causing inflammation, and narrowing your arteries. The heart and arteries cause higher blood pressure. 7. Reduce excess stress. We live in stressful times. Workplace and family demands, national and international politics, they all contribute to stress. Finding ways to reduce your own stress is important for your health and your blood pressure. There are lots of different ways to successfully relieve stress, so find what works for you. Practice a deep breathing, take a walk, read a book, or watch a comedy. 8. Try meditation or yoga. Mindfulness and meditation, including transcendental meditation, have long been used and studied as methods to reduce stress. Yoga, which commonly involves breathing control, posture, and meditation techniques, can also be effective in reducing stress and blood pressure. 9. Eat some dark chocolate. Yes, chocolate lovers, dark chocolate has been shown to lower blood pressure. But the dark chocolate should be 60 to 70% cacao. A review of studies on dark chocolate has found that eating 1 to 2 squares of dark chocolate per day may help lower the risk of heart disease by lowering blood pressure and inflammation. The benefits are thought to come from the flavonoids present in chocolate with more cocoa solids. The flavonoids help dilate or widen your blood vessels. 10. Try medicinal herbs. Herbal medicines have long been used in many cultures to treat a variety of ailments. Some herbs have even been shown to possibly lower blood pressure, although more research is needed to identify the doses and components in the herbs that are most useful. Always check with your doctor or pharmacist before taking herbal supplements. They may interfere with your prescription medications. 11. Make sure to get good, restful sleep. Your blood pressure typically dips down when you're sleeping. If you don't sleep well, it can affect your blood pressure. People who experience a sleep deprivation, especially those who are middle-aged, have an increased risk of high blood pressure. 12. Eat garlic or take garlic extract supplements. Fresh garlic or garlic extract are both widely used to lower blood pressure. According to one clinical study, a time-release garlic extract preparation may have a greater effect on blood pressure than regular garlic powder tablets. 13. Eat healthy, high-protein foods. A long-term study concluded in 2014 found that people who eat more protein had a lower risk of high blood pressure. High-protein foods include fish, such as salmon, or canned tuna in water, poultry, such as chicken breast and eggs, chickpeas, beef, beans and legumes, such as kidney beans and lentils, nuts or nut butter, such as peanut butter, and cheese, such as cheddar. 14. Take these BP-lowering supplement, omega-3 polyunsaturated fatty acid. Adding omega-3 polyunsaturated fatty acids or fish oil to your diet can have many benefits. Whey protein. This protein complex derived from milk may have several health benefits, in addition to possibly lowering blood pressure. Magnesium. Magnesium deficiency is related to higher blood pressure. A meta-analysis found a small reduction in blood pressure with magnesium supplementation, coenzyme Q10. In a few small studies, the antioxidant CoQ10 lowered systolic blood pressure by 17 mm Hg and diastolic up to 10 mm Hg. In citrulline, oral L-citrulline is a precursor to arginine in the body, a building block of protein, which may lower blood pressure. 15. Drink less alcohol. Alcohol can raise your blood pressure, even if you're healthy. It's important to drink in moderation. Alcohol can raise your blood pressure by 1 mm Hg for each 10 grams of alcohol consumed. 16. Consider cutting back on caffeine. Caffeine raises your blood pressure, but the effect is temporary. It lasts 45 to 60 minutes, and the reaction varies from individual to individual. One study indicated that caffeine's effect on raising blood pressure is greater if your blood pressure is already high. And 17. Take prescription medication. If your blood pressure is very high or doesn't decrease after making these lifestyle changes, your doctor may recommend prescription drugs. They work and will improve your long-term outcome, especially if you have other risk factors. However, it can take some time to find the right combination of medications. Talk with your doctor about possible medications and what might work best for you. That concludes our video for the 17 effective ways to lower high blood pressure. If you enjoy watching this video, don't forget to click the thumbs up button, share to your friends, and subscribe to Earlyseven YouTube channel for more rad-clusive videos.